It is Wednesday, June 10th. We are here with Deputy Health Officer Dr. Josh Ennis for Wednesday's media availability. Dr. Ennis, can you provide an update showing how the modeling has changed since modifications have been made to the county's shelter-in-place model? When is the peak for deaths and hospitalizations now? And what is the percentage of mitigation now?
Sure. Before I get into the specifics of answering this question, I think it's helpful to talk about how we use modeling and why we presented it when we did. Modeling takes one point in time, makes a set of assumptions, and then runs that through the entirety of whatever window of time you're looking at for whatever question you're hoping to answer. And so, when I presented those models quite some time back, we made lots of assumptions, and we really used them to bookend the two extreme ends of a scenario that we could be faced with. The model is static. It doesn't change over time. It assumes the same conditions are kept throughout the entirety of the model. And so we know that real life is way more dynamic. Things are changing all the time. And so it's real hard to apply a model to every kind of day-to-day disease tracking and what we're seeing at the county. So the real value back then may not be as applicable now. With that being said, there is some state modeling that's looking at kind of what's happening right now, what's happening over the next 2 to 4 weeks, what's happening over months, if you want to go back and look at that. So getting back to the question, how has the modeling changed? Well, I think we clearly haven't suffered from that worst case scenario. Our non-pharmaceutical interventions have worked. But we're so early in this still, as evidenced by our low numbers and the more recently several days in a row with no confirmed cases, that we're subject to a lot more variability because of the small numbers. And so the models kind of break down when we're that early in the game. As far as percent mitigation goes, I think we modeled a 40% mitigation. And I think we may have been even perhaps more effective than that. That was based on social mobility data. I don't know that I have a real good idea of where we're at now. We know that as things open up more, that number will certainly trend lower again, and we'll see disease spread faster. That is to be expected.
Okay, thank you. How is the modeling expected to change as the county moves from phase 2.5 to phase 3 at some point down the line?
Yeah, I think that's a hard question to answer because the modeling, it doesn't really apply at this point as well because we're subject to small numbers. Again, early on, it was helpful to talk about the two bookends of what we could be facing, and that helped inform the process for planning. So we'd make sure we can meet the number of patients that there potentially could be as a long-term objective. Right now, I don't want people to be lulled into complacency because we're seeing very few cases, because if there's a large a gathering of some type and one person there is symptomatic, it could quickly throw us into a more dire situation than what a model at this point with 30 or 40% mitigation would predict.
Thank you. The state's COVID website reports the number of people currently hospitalized due to COVID-19 in Humboldt County, and also the number of people currently hospitalized in the ICU. Are these figures accurate? Why does the county not report them? Also, why do the state's total number of confirmed cases differ from the county's?
Yeah, so maybe I'll just break it down by each of the different categories there. So for currently hospitalized and those in the ICU, those figures, they are compiled and collected directly from hospitals, so they are accurate. However, there is a bit of a lag in them being reported out. So what you'll see reported out on the website is several days behind where we're currently at. As far as numbers for cases, that is pulled from a state database, and that figure is inaccurate. It is slightly greater than what we have locally. They're pulling it from a state database, and the state database has some duplicate tests in there. And so some of those need to be reconciled. Additionally, there's some, I'll give you an example, like the address of residence. If it's logged inappropriately, but then it turns out the person actually lives in another county, there's been at least one instance where that occurred. So the state's website is slightly inaccurate, and we're working to try and clean that up. I don't think it's any problems that public health has contributed to. We're looking to clean up on the cases that for these problems that were created more kind of on the laboratory reporting side. The county's numbers we know are very accurate because we've kept an ongoing log of all the confirmed positive cases, and we've reconciled it. So we feel confident in our local numbers.
We currently have the fewest number of confirmed active cases that we have had at any point within the last 30 days, despite the county significantly loosening restrictions in the interim. What conclusions can you draw from this fact? What questions does it raise in your mind?
Yeah, so I think as far as conclusions go, I think, again, I've already said this, but I think shelter in place really did work. We saw that when it went into place, travel was still occurring, and it took a couple months for that to really slow down. And through our case investigation and contact tracing, we saw that people were still traveling, and that was one of the big drivers of continued cases within our county. I think people are, on the whole, taking this more seriously and playing their part and contributing to limiting spread of disease. And so, you know, that's the conclusion I would draw from that, that we really do exercise the ability to alter the course of this. It raises a lot of questions in my mind, though, that when we see the counts dropping real low and we're opening things, because more and more people are going to be coming together. And so our long-term response, I think, is something that we've been thinking about a lot. And what are we going to be looking for in terms of monitoring the disease? We know that asymptomatic transmission does play some part in this, and so we want to continue testing throughout this so we have an early indicator of more widespread disease. Other questions too are if we get a little too far ahead of ourselves and we're bringing lots of people together, it only takes a couple of these events with some symptomatic or asymptomatic people spreading disease, and we could quickly become into a scenario where we're not capable of doing as strong case investigation and contact tracing as we have been capable of previously. So those are some of the questions that come to mind as we see the numbers dropping.
With over 100 COVID-19 positive tests here in Humboldt, can you break down for us the demographics of those who've tested positive? In addition to the regular information given on age, gender, and geographic location, could you break the numbers down by race, income level, education level, what percent are essential workers, etc.?
Yeah, so as far as each of these goes, we are collecting some more demographics other than just what we're reporting on. Race is a big one. As far as income and education level goes, those would be interesting to look at, but we're not currently collecting it. I don't know of the state currently collecting it. We are at County Public Health, we are looking at creating a dashboard that is available that can give some of this information for people to look at. Essential workers as well is something that I know the state is starting to look at. They have a surveillance project ongoing that our county is looking at participating in, and so we hope to have a little more information regarding that as well, to try and find out what occupations or settings expose people to more risk of contracting the disease that haven't been identified yet.
Could you comment on transmissibility of asymptomatic people in light of WHO Dr. Maria Van Kerkhove's comments about the transmissibility of asymptomatic people versus pre-symptomatic and mildly symptomatic spread, and her later clarification?
Yeah, I think perhaps this question was maybe submitted before she kind of further clarified and walked back on maybe some of her statements, but I think the gist of it is that she said that asymptomatic transmission is very rare, and she later clarified that she wasn't talking about the modeling that suggests that it is actually a bigger driver. You know, when I first heard this comment, I found myself thinking, well, that can't be. I mean, anecdotally at the county level, we have seen cases where someone's asymptomatic and they are the missing link between, you know, two other cases that we know are linked through this one person. And we've also tested people who are asymptomatic, and, you know, it's clear to us that it is occurring. Some models suggest that it's as much as a third or even 40% of all transmission is occurring to asymptomatic cases. I think early on there was some confusion about lumping pre-symptomatic people. So in that first day or two, right before someone becomes symptomatic, they can still spread the disease, and we've seen that anecdotally at the county level as well. And early on, some of the studies were lumping those pre-symptomatic people in with the asymptomatic people, and so there was a little bit of confusion about that. But you know, in our minds, it's a mischaracterization to say that it's very rare.
Thank you. Can a business refuse patrons from coming inside their business if not masked?
Yes, they can refuse that they come inside, but it is not required. I think we're all familiar with the sign in the front of many businesses that says, no shoes, no shirt, no service. You could add no mask to it if you wanted.
What about those who are exempt from wearing masks? Is it discrimination similar to refusing service to those with a service animal?
Yeah, we try to regularly remind the public and businesses that some people, by the health officer's orders, are exempt from wearing a mask for medical reasons. And, you know, so I would encourage everyone to be mindful that not everyone can wear a mask. And that is described in the order itself. So not everyone can wear a mask. Some people do have legitimate medical reasons for not doing so.
Thank you, Dr. Ennis.
Yeah, thank you.